Texto Padrón. She kept her health insurance after retirement, paid every premium, never missed a payment, and Medicare still hit her with a permanent penalty, one she will pay every single month for the rest of her life. Not because she did anything wrong. Because of one rule nobody explained before her window closed. Her name was Susan. And this is exactly what happened. She did everything she was supposed to do. She worked for 33 years, paid into the system, and when she retired, she made sure she still had health coverage. She did not just walk away unprotected. She kept her plan. She kept paying her premiums. She felt responsible. She felt safe. And 2 years later, sitting at her kitchen table with a Medicare penalty notice in her hands, she realized that the coverage she thought was protecting her had done nothing of the kind. If you are approaching 65, or if you retired recently and you are still on a health plan from your former employer, this video could be the most important thing you watch this year. Because the mistake I am about to describe is not a mistake that careless people make. It is a mistake that responsible, organized, thoughtful people make every single day. And the cost of it follows them for the rest of their lives. Stay with me. Her name was Susan, 66 years old. Retired middle school teacher from outside of San Antonio, Texas, 33 years in the classroom, the kind of woman who had her retirement planned out years in advance. She knew exactly when she wanted to stop working. She knew what her pension would look like. She had savings. She had a plan. When she retired at 64, her school district offered her something she was grateful for: a retiree health plan. Former employees could stay on the district's group health insurance for a monthly premium. It was not cheap, but it was real coverage: doctor visits, prescriptions, hospital care. Susan signed up immediately. She felt taken care of. And this is where it gets expensive. Because Susan assumed, reasonably, based on everything she had been told, that staying on her former employer's health plan meant she did not need to rush into Medicare. She was covered. She had insurance. She would get around to Medicare when the time felt right, maybe at 65, maybe a little after. There was no urgency. She had coverage. What nobody told her, what her HR department did not explain, and what the Medicare letter she received in the mail did not make clear enough, was that her retiree health plan did not count. Not for Medicare's purposes, not as a valid reason to delay. This is what most people do not realize. Medicare makes a very specific distinction between two types of employer coverage. The first type is active employer coverage, meaning you are currently employed, your employer has 20 or more employees, and you are covered under their active group health plan right now. If that is your situation, you can legally delay Medicare Part B without any penalty. When you eventually retire or lose that coverage, you get a special enrollment period and you can sign up without consequence. The second type is everything else. Retiree health plans, COBRA coverage, coverage through a spouse who is also retired, individual plans purchased through the marketplace. These do not qualify. These do not protect you from the Medicare late enrollment penalty, and every year thousands of people find this out the hard way after the damage is already done. Susan found out at 66. She had gone a full year past her initial enrollment period, the 7-month window that opens 3 months before your 65th birthday and closes 3 months after, while covered by a plan that Medicare did not recognize as a valid reason to wait. She called Medicare when she finally went to enroll. She explained that she had been covered the whole time. She had not gone without insurance for a single day. Surely that counted for something. The person on the other end was patient. They explained the rule clearly. Susan's retiree health plan, while real and legitimate coverage in every practical sense, was not considered creditable coverage under Medicare's definition for the purpose of delaying Part B enrollment without penalty. Because she had missed her initial enrollment period without a qualifying exception, a late enrollment penalty would be added to her Part B premium. 10% for every 12-month period she had gone without Part B. Susan had waited just over a year. That was a 10% permanent increase on her Part B premium. Every month. For the rest of her life. And this is not even the worst part. During that year, she had waited, Susan had needed medical care. A specialist visit for a persistent knee problem, follow-up imaging, a minor outpatient procedure, All of it covered under her retiree health plan, but only partially, because her retiree plan was structured as secondary to Medicare, meaning it was designed to pay after Medicare paid. But Susan did not have Medicare yet, so her retiree plan was paying as primary, and it was not designed to carry that load alone. The gaps in coverage were larger than she expected, and the bills that came in were higher than they should have been. She added it all up eventually, the penalty she would now pay permanently, the out-of-pocket medical costs from that year of unexpected gaps. The difference between what she paid and what she would have paid with Part B in place. The total was not dramatic in a single moment. It was quiet and steady, the way these things always are. A few $100s here, a higher premium there, month after month. And when she looked at it across a 5-year horizon, the number was significant. Thousands of dollars she had not planned to spend, from a decision that felt responsible at the time. What happened next surprised her. Susan started talking to other retired teachers in her network, women she had worked with for decades, and she discovered that she was not alone. Several of them had made the same assumption, that staying on the district retiree plan was the same as having valid coverage, that they were protected, that Medicare could wait. One of her colleagues, a woman named Diane, had waited 2 years before enrolling in Part B. Her penalty was 20%. Permanent. She was in her early 70s now and still paying it every single month. She had no idea there was anything she could do about it when it happened. She had just accepted it as part of the system. And this is exactly where people lose money. Not because they are reckless, because they are trusting, because they assume that having health insurance, real, paid, legitimate health insurance, is the same as having creditable coverage under Medicare's rules. It is not. And the system does not explain that difference loudly enough before the window closes. Now let me explain the rule clearly, because understanding it is the only way to avoid it. When you turn 65, Medicare gives you a 7-month window to enroll in Part B without any penalty. That window is called the initial enrollment period. It starts 3 months before the month of your 65th birthday, includes your birthday month, and ends 3 months after. If you enroll during that window, you pay the standard premium. No surcharge, no penalty. You are in the system at the base rate. If you miss that window, you generally face a penalty of 10% added to your Part B premium for every 12-month period you were without Part B and without a qualifying reason for the delay. And that penalty is permanent. It does not go away after a few years. It does not reset. It stays with you on every Medicare premium bill for as long as you are enrolled. The only legitimate reason Medicare accepts for delaying Part B without penalty is being actively covered by a group health plan through a current employer, yours or your spouse's, where that employer has 20 or more employees and you or your spouse are actively working. That is the exception. That is the only one that protects you. Retiree health plans do not qualify. COBRA does not qualify. Marketplace plans do not qualify. Coverage through a spouse's retiree plan does not qualify. These are all real forms of insurance. They cover real medical expenses, but Medicare does not recognize them as a valid reason to delay enrollment. And if you rely on them to protect yourself from the penalty, you will find out, the way Susan found out, that they did not. Now here is the part of Susan's story that connects to something even bigger. Something that most people who find themselves in her situation never think about until it is too late. When Susan finally enrolled in Medicare Part B, she had a decision to make. How did she want to fill the gaps that original Medicare leaves behind? The 20% cost sharing with no out-of-pocket maximum, the missing dental, vision, and hearing coverage. She had 2 main options, a Medigap supplement plan or a Medicare Advantage plan. And this is where the story takes a turn that I want you to hear carefully. Because Susan was in her first year of Medicare. And that first year is the most valuable window in your entire Medicare life. During that window, specifically during the 6 months after your Part B coverage begins, you have what are called guaranteed issue rights for Medigap. Any Medigap insurance company in your state is legally required to sell you a plan at the standard rate. No medical underwriting, no review of your health history, no higher premium because of pre-existing conditions. You are guaranteed access, no questions asked. But once that window closes, once you are past that first year on Medicare, those protections largely disappear. If you want to switch to a Medigap plan after that window, the insurance company can review your health history. They can charge you more. And in many states, if your health has changed, they can deny you coverage entirely. Susan chose a Medicare Advantage plan in her first year. The $0 premium looked appealing after the financial hit she had already taken from the penalty. She wanted to lower her monthly costs, and for a while it worked. Her routine care was covered. Her network included her primary care doctor. Everything seemed fine. Then her knee problem, the same one she had been dealing with since before she enrolled, required surgery. Her orthopedic surgeon was in her plan's network. But the surgical facility her surgeon preferred was not. And the physical therapy practice she had been using for months was suddenly out of network after a mid-year network update she had not noticed. The bills that followed were not catastrophic, but they were real, and they were unexpected. And when Susan tried to switch to a Medigap plan the following year, because she now understood what network restrictions actually meant in practice, she ran into the wall that so many people hit after their first year. She was past her guaranteed issue window. Her knee surgery was on her medical record. The Medigap companies she contacted in her state could review her history. 2 of them quoted her a significantly higher premium. 1 declined her application entirely. She was not without options. But the options she had in her first year, the clean, guaranteed, no questions asked access to any Medigap plan at the standard rate, were gone. And they were gone because she had used that window focused on lowering her monthly cost rather than understanding what the window actually meant. This is what most people do not realize. The decisions you make in your first year of Medicare are not just about this year. They shape what your options look like for every year after. The guaranteed issue window is not just a formality. It is the one moment in your Medicare life when your health history does not matter, when no insurance company can turn you away, when the playing field is completely level, and most people spend it looking at premium numbers without understanding what they are actually choosing between. Susan eventually found a Medicare Advantage plan with a broader network and a lower out-of-pocket maximum than her original plan. It was not the clean exit she had hoped for, but it was better than where she was. She adjusted. She moved forward. But she told me something that stayed with me. She said, "I did everything I thought I was supposed to do. I kept my coverage. I stayed insured. I did not skip anything. And I still ended up with a penalty, unexpected bills, and fewer options than I should have had. And none of it needed to happen. If someone had explained these 2 rules to me before I retired, the one about retiree plans not counting and the one about the first-year window, I would have made completely different decisions. 2 rules. That is all it was. 2 rules that nobody explained clearly before the window closed. If you are approaching 65 and you are currently on a retiree health plan, a COBRA plan, or any coverage other than active employer group insurance, your most important job right now is to understand your initial enrollment period and not miss it. 3 months before your birthday month. Your birthday month. 3 months after. That is your window. Do not assume your current coverage protects you from the penalty. Confirm it with Medicare or a certified counselor before the window passes. And if you are in your first year of Medicare right now, if you have recently enrolled and you have not yet decided how to fill the gaps in your coverage, please understand what the guaranteed issue window means before it closes. Talk to someone who can explain both options clearly, not a salesperson for one insurance company. Someone who can show you the full picture and help you understand what you are actually choosing between. Your State Health Insurance Assistance Program, SHIP, offers free one-on-one counseling from trained advisors who have no financial stake in what plan you choose. No commissions, no sales pitch, just someone who can sit with your specific situation and help you see the full picture before a window closes that you cannot reopen. Find your state's program at Medicare.gov. Susan knows these rules now, Diane knows them now, and now you do too. The question is whether you learn them before the window closes or after. The next video on this channel goes deep into Medicare Part D, prescription drug coverage. Most people set up their Part D plan once and never look at it again. But formularies change every year. And if your medications have changed and your plan has not been reviewed, you may be paying far more than you should at the pharmacy right now. That video is coming up next.